Hi, my name is Marcia and I'm a student at Florida State College of Jacksonville. Today I'll be doing a presentation on the different roles that nurses play in community health. In particular, I will be talking about faith community nursing. The reason why I selected this particular topic is because, frankly, this is a nursing role that I did not know existed. I am a person who, as a kid, was raised in a very religious household and went to church quite frequently. We actually went to church every Tuesday, Friday, and Sunday. And I cannot recall any active role that nurses played in my church. So when I heard about faith community nursing, I was very fascinated by virtue of just not knowing about what these nurses did. And when I found out what they did and how they had the potential to impact the healthcare community as a whole, I was very, very interested in the subject and wanted to share that with you all. So this will be a very short presentation, but I hope that you learn a lot, and I hope that you enjoy the presentation as much as I enjoyed researching it and making it. So let's get into it. So first of all, faith community nurses are just basically, that's just an umbrella term. These nurses are called different things according to the different religion or religious community that they serve. So they can be called parish nurses, holistic nurses, congregational nurses, a church nurse, crescent nurse. They're called just different things, but basically these nurses serve the health and religious needs of the specific community of faith. So whether they are Muslims, Christians, Catholics, or Jews, these particular nurses serve the needs of their religious community. And they do this by basically participating or facilitating different activities. These nurses are health advisors. They educate their parishioners on different health issues. They visit ill patients, whether they're in the hospital or at home. They basically can help educate these particular patients on their diagnosis, help them basically recover, give them more information, help to make sure that they're compliant with their medical needs. They also develop support groups. They train volunteers so that they're better able to help the different members of the church. They run health screenings, and on occasion they can refer patients to outside counsel, whether it be in a hospital or clinic setting. These nurses really have to be great people, like people persons, and they have to be able to help a variety of church members or congregational members across the lifespan. So whether it's children, adults, or elders, they have to be able to gear their education and their teaching and their activities towards different groups of people. So they really have to have a good nursing knowledge base, and they have to be able to gear that knowledge towards different folks. So as far as children, for instance, we all know that kids or young teens, they are at that age where they kind of are wanting independence. They need positive reinforcement. And so when you're gearing education towards these particular people, it's best to have a very warm approach. Build trust first. Then when you get into the educational subject, it's important that you be repetitious, especially with young kids. Allow the teenagers to be autonomous and be able to guide their own teaching. And this is especially true, especially when you're dealing with young kids who are dealing with ailments like type 1 diabetes or asthma and things like that, and they don't want to feel like they are being singled out. So you want to basically gear those topics towards them in a way that is not invasive of their privacy, and in a way that they feel comfortable, so that you're able to build enough trust so they can come back to you if they have any questions. Also with adults, people assume that you're an adult so you really don't need any guidance. But as nurses just working in the hospital, we know that adults, they sometimes need the most guidance. So it's very important important that these nurses be respectful, that these are adults, but that they gear their education towards meaningful experiences, meaning that they make the education geared towards things that these particular adults in this congregation can relate to. So if they're teaching about fitness or nutrition or something like that, they may want to teach it in a way such as, like, how to make nice, healthy, quick meals for a family of four, or how to fit working out or getting fit into a busy work week and things like that. These would be activities, and these would be educational information that would work with these particular adults' lifestyle, and they would be more apt to listen to this. Role playing is always good, and audio visuals are excellent when teaching this particular group. As far as elderly people, we all know that, if you go to church, or if you go to and participate in any religious community, that they have a large amount of elderly people there. It's important that when you're teaching these particular people, that you speak slowly. These people are declining in age, vision sometimes is starting to go, the hearing is starting to go, and a lot of time you need to allow these people, they don't necessarily have a short attention span, but you want to allow them enough time to finish activities. Speak slowly and offer visual aids and offer extra time for them to do these things. And just like adults, you want to gear the information to subjects that affect their life. So it's very, very important that these nurses, like again, I said, these nurses be able to go into this big community of folks and be able to reach out to people across the lifespan. Now, in order for somebody to become a faith community nurse, they must first be a nurse, and it doesn't hurt to have like a medical surgical background, some kind of background in nursing. So either you become a bachelor's nurse, associate nurse, or get some kind of a diploma from an approved school of nursing. And then I believe you need 1,000 credit hours of nursing time, and you can actually apply for accreditation as of 2014. So this is a relatively new specialty. So you can apply for accreditation as of 2014. And if you really want to advance your career, this is something that you can specialize in, but it's usually something that has to be integrated with faith ministry. So whether it's being a pastor or some kind of rabbi or some kind of higher church position. You can also get master's, doctorates in this degree as well. These nurses pretty much work with a lot of different disciplines. It can be several different members of the clergy. They can be different doctors, and as well as nurses and medical assistants. These nurses have to have at least basic nursing skill. This is a must, basic nursing skills, because you want to be able to perform good assessments, be able to do good blood pressures, be able to know what it means when somebody has an elevated blood sugar. And like I said, those are basic nursing skills. But aside from that, this person has to be a good public speaker, because a lot of times you're asked to go before the congregation, and it's best that you will be able to convey your message appropriately. Also, you need to be able to have some spiritual knowledge, because a lot of people feel like healthcare should belong in one box, and faith and spirituality should belong in another box. But a lot of people who go to church, they go to church when they're sick, they ask their pastors to pray for them, and so when people are religious, they want God to be in more than just the church. They want the God to be in their family. They want God to be with them in their health. And so it's very important that these nurses have a spiritual knowledge base. Also, education. This person needs to be able to have some good nursing education and some nursing theory, and she needs to be able to express that and be able to impart that on these parishioners. This nurse is oftentimes going to be working alone, so it is very important also that she is a leader. She needs to be able to take a leadership role. She will be tasked with responsibilities like running health screenings and training volunteers. And she is going to be the go-to person, the liaison to the health care world. So she needs to be able to be a good leader, and be able to be trusted in this particular arena. So what I learned about this particular this particular nursing role is that only 35% of the faith community nurses are compensated financially for their ministry. And while I understand that they may not want to be compensated financially for this ministry. A lot of them do it as a labor of love. I feel that this is something that they deserve. They do deserve some kind of compensation, because these nurses actually can increase primary care use by 162% among uninsured patients. Just by virtue of what they do, they basically encourage people to seek health care. They encourage people to go see primary care physicians. They also help patients recover once they're discharged from hospitals. They have a very heavy burden with educating patients, and while they don't necessarily do a lot of hands-on nursing care, the encouraging, the educating and stuff like that, all of those things really help patients and encourage patients to seek outside care, and go into hospitals and be treated. So these nurses are very invaluable to the members of the church that they serve. So yes, I do feel that they should be compensated, and I was surprised that more of them were not compensated. So basically, that's it on faith community nurses. This seems like a fabulous role if you are a religious nurse. It seems like a wonderful role to be in. I feel like you have a lot of autonomy. I feel like these nurses will have the potential to have the biggest impact on the communities that they serve, even more than nurses in the hospital, I believe. So I want to thank you all for watching this presentation. I hope that it served you well. I hope that you can go into your communities and sort of do some of the things that were suggested in this presentation. Thank you very much for your assistance with this, and thank you. You have a great day.